What might a caregiver feel? It is normal to be distressed and upset when a family member is diagnosed with a mental illness. Some common emotions include feeling as though they have lost the person they used to know. For example, the person you love has become someone else. Or feeling that all hopes are lost for the patient's future. That is, the child cannot handle a full-time job anymore. This is particularly so when patients are young. Other than that, a change of roles may happen within the family. For example, parents having to take up as much responsibility as they did when their child was younger. And loss of self-confidence. That is, blaming themselves for not being able to protect their child. Some family members may feel guilty and feel partially responsible for the illness of the patient. This may put further stress on the caregivers. Family members may also be extremely sad about this. In order to recover from grief, it is important to acknowledge and accept the emotions felt at different stages. The experience of grief varies from person to person, even within the same family, and each family member may feel different degrees and stages of sadness. Nonetheless, there are some common stages we may go through. Shock or denial. This response is a psychological defense mechanism to protect us from sadness. Usually, family members may trivialize the symptoms and attribute that to other causes, such as lack of sleep, etc. Some example of this response include family members saying that this can't be, or that the doctor doesn't know what he or she is talking about. Anger. Family members may be angry when they are feeling helpless or weak. The anger can be directed at those whom we consider to be responsible for the onset of the disorder, the family members themselves, relatives, or even at the people who are trying to help the patient, for example, professionals, social workers, and teachers. Negotiation. Family members may keep thinking about what could have been done or what might have been done better to avoid this situation. If these feelings are not dealt with properly, the guilt may stop them from recovering from grief. Depression. When family members realize the severity of the illness, they may become depressed. Depression can be reflected in the following behavior, thoughts, or feelings. Appetite or sleep patterns may be affected. Fatigue may be experienced. The person may feel detached, lonely, isolated, numb, or self-pitying and tearful. Sometimes professional help may be needed. Acceptance. In this stage, family members will learn that life goes on even though the patient is ill. They start to accept the fact that they have lost something and are capable of handling different emotions. When family members are able to perceive the loss as part of their life experience, they may start to recover from grief. Experiencing the above stages is very common, but not all family members will experience them, and the duration of each stage may vary. If you are experiencing them, try not to avoid these feelings, but instead accept them, as they will help you gradually recover.